Conditions that lead to contempt from others. Chapter 1. Conditions that lead to contempt from others. Due to physical characteristics, contempt is a complex and multifaceted emotion, characterized by a sense of superiority and disdain towards others. This feeling can manifest in various forms, from fleeting emotions to long-lasting sentiments, and can be particularly harmful when directed at individuals based on their physical characteristics. Here are the key conditions that can lead to contempt due to physical traits. 1. Perceived inferiority and character judgments. Contempt often arises when one person perceives another as morally or socially inferior. This perception can be unfairly linked to physical traits that society deems undesirable or inferior. For example, certain physical characteristics might be wrongly associated with negative stereotypes about moral or intellectual deficiencies. Example 1. A person with visible tattoos and piercings might be judged as rebellious or irresponsible. Example 2. An individual with physical disabilities might be unfairly seen as less capable or dependent. Example 3. Someone with a disheveled appearance might be perceived as lazy or lacking self-discipline. 2. Self-neglect and poor hygiene. Conditions like Diogenes syndrome, which involves severe self-neglect and poor hygiene, can lead to social stigma and contempt. People suffering from this syndrome are often judged harshly based on their physical appearance and living conditions, which may evoke contempt from others. Example 1. A homeless person with unkempt hair and clothing might be looked down upon and avoided. Example 2. An elderly individual suffering from neglect might be seen as dirty and pitiful. Example 3. A person with untreated medical conditions affecting their appearance might be unfairly judged as negligent. 3. Non-conformance to social norms. Individuals who do not conform to societal standards of beauty or normalcy often face contempt. This can include those who are obese, have visible disabilities, or make unconventional fashion choices. The contempt in these cases is rooted in societal biases and a lack of acceptance of diversity. Such biases reflect broader social prejudices related to race, gender, age, and other physical characteristics. 4. Example 1. An overweight person might be ridiculed and blamed for their weight despite underlying health issues. Example 2. A person with unconventional fashion choices, like Gothic or punk styles, might be seen as attention-seeking or rebellious. Example 3. Someone with a visible skin condition, such as psoriasis, might be unfairly judged as contagious or unclean. 4. Association with negative traits. Certain physical characteristics may be wrongly associated with negative personality traits or behaviors. For example, visible signs of poverty or disability might lead to unwarranted assumptions about a person's work, ethic, or moral character, resulting in contempt. Example 1. A person with a facial scar might be seen as aggressive or untrustworthy. Example 2. An individual with severe acne might be judged as having poor hygiene or unhealthy habits. Example 3. Someone with a prominent birthmark might be unfairly associated with superstitions or negative stereotypes. 5. Psychological and emotional impact. The impact of being the target of contempt due to physical traits is profound. It can lead to severe psychological and emotional harm, affecting self-esteem and contributing to mental health issues like depression and anxiety. The destructive nature of contempt means it not only devalues the person it is directed at, but also harms the perpetrator's relationships and social connections. Example 1. A teenager bullied for their appearance might develop severe social anxiety. Example 2. An adult facing workplace discrimination due to their weight might experience depression. Example 3. A child with a visible disability might suffer from low self-esteem due to peer rejection. 6. Personality dynamics and dispositional contempt. Some individuals are more predisposed to feeling contempt, a trait known as dispositional contempt. These individuals are likely to frequently feel superior to others, often based on superficial judgments, including physical appearance. Understanding the personality dynamics behind dispositional contempt can help address and mitigate its harmful effects. Example 1. A person who frequently feels superior to others based on physical appearance might habitually mock those they consider unattractive. Example 2. An individual with high dispositional contempt might avoid socializing with people they deem physically inferior. Example 3. A person prone to contempt might regularly express disdain towards others' fashion choices or body types. Contempt, especially when based on physical characteristics, underscores the need for greater empathy, acceptance, and understanding in society. Addressing the root causes of such contempt involves challenging societal biases, promoting inclusivity, and fostering a culture of respect for all individuals, regardless of their physical traits. Chapter 2. Understanding and overcoming contempt in relationships. Contempt is often described as the most destructive emotion in relationships. It signifies a sense of superiority and disdain, and when left unaddressed, can poison the emotional and physical health of both partners. Understanding what contempt is, recognizing its signs, and learning how to manage it are crucial steps towards fostering a healthier relationship. 1. What is contempt? Contempt is characterized by behaviors that convey disrespect and scorn. Common expressions include sarcasm, cynicism, name-calling, eye-rolling, sneering, and hostile humor. These actions not only hurt the person on the receiving end, but also indicate deep-seated issues within the relationship itself. 1. 2. The impact of contempt. Contempt is considered one of the four horsemen, identified by Dr. John Gottman, behaviors that predict divorce with a 93% accuracy. It is the most significant indicator of an unhealthy relationship, and can lead to emotional and physical harm for both partners. When contempt is present, it signifies a deep level of disrespect and a lack of admiration, which are essential for a thriving relationship. 5. 3. Recognizing contempt. Recognizing contempt in your relationship is the first step towards overcoming it. Signs include sarcasm and cynicism, using cutting remarks or irony to belittle your partner. Name-calling and mockery, derogatory terms, or making fun of your partner in a mean-spirited way. Eye-rolling and sneering, nonverbal cues that display disgust or disdain. Hostile humor, jokes at your partner's expense that are meant to hurt rather than entertain. 4. Managing contempt. Acknowledge the issue. The first step is to recognize and admit that contempt exists in your relationship. This acknowledgement opens the door to addressing and resolving the underlying issues. Practice compassion and empathy. A cardinal rule for overcoming contempt is to make eye contact and listen actively when communicating. Eye contact humanizes your partner and fosters a sense of connection. Empathy helps you understand your partner's perspective and reduces feelings of superiority. Communicate respectfully. Use I statements to express your feelings without blaming your partner. For example, instead of saying, "You never listen to me," say, "I feel unheard when I try to talk to you." This approach reduces defensiveness and promotes constructive dialogue. Seek professional help. Couples therapy can be instrumental in overcoming contempt. A therapist can help identify destructive patterns and provide strategies to foster respect and understanding in the relationship. Set boundaries and practice self-care. If contempt persists, it may be necessary to set boundaries and focus on self-care. This might involve taking a break from toxic interactions and prioritizing your own mental and emotional well-being. 5. Conclusion. Contempt is a powerful and damaging emotion, but it is not insurmountable. By recognizing the signs, fostering empathy, communicating respectfully, and seeking professional help, couples can overcome contempt and build a healthier, more respectful relationship. Taking these steps not only improves the quality of the relationship, but also enhances the well-being of both partners. Chapter 3. Conditions that lead to contempt from others. Due to mental characteristics. 1. Perceived moral inferiority. Individuals may be viewed with contempt if they are perceived to have lower moral standards or character defects. This includes actions or behaviors that are considered unethical or immoral by societal standards. Example 1. A person who consistently lies to manipulate situations is viewed with contempt. Example 2. Someone who engages in theft, despite having the means to obtain things legally, is seen as morally inferior. Example 3. An individual known for breaking promises, leading others to distrust them. Methods to address encouraging open communication and promoting ethical behavior can help. reduce feelings of contempt. Providing moral support and counseling might help individuals improve their behavior and regain respect. 2. Psychological health issues. Certain mental health conditions, such as Diogenes syndrome, which involves severe self-neglect and hoarding behavior, can lead to others feeling contemptuous. This is often due to the perceived lack of self-care and the social stigma associated with these behaviors. Example 1. A person with hoarding disorder who accumulates excessive items, causing distress to their family. Example 2. An individual with severe depression who neglects personal hygiene, leading to social isolation and contempt. Example 3. Someone with untreated schizophrenia, exhibiting behavior that others find unsettling. Methods to address mental health. Interventions, including therapy and support groups, can help individuals manage their conditions. Raising awareness about mental health can reduce stigma and contempt. 3. Social nonconformity. Behaviors that deviate significantly from social norms can elicit contempt. This includes actions that are seen as socially irresponsible or deviant, which may cause others to view the person with disdain. Example 1. An activist pushing for radical social changes faces contempt from those who prefer the status quo. Example 2. An artist whose work challenges societal norms is ridiculed and dismissed. Example 3. A person with an unconventional lifestyle, e.g., living off the grid, is viewed with contempt by mainstream society. Methods to address. Promoting diversity and inclusion, and encouraging understanding and acceptance of different perspectives can mitigate contempt. Providing platforms for dialogue can help bridge gaps and reduce prejudice. 4. Indifference to others' hardships. Demonstrating indifference or a lack of empathy towards the suffering or difficulties faced by others can lead to contempt. This perceived emotional coldness or lack of compassion is often judged harshly. Example 1. A corporate executive who disregards employees' concerns about working conditions. Example 2. A politician who ignores the needs of disadvantaged communities. Example 3. A healthcare professional who is indifferent to patients' pain and suffering. Methods to address. Fostering empathy through training programs and workshops can help individuals develop better interpersonal skills. Encouraging acts of kindness and empathy in the workplace can improve relationships. 5. Arrogance and superiority. Displaying a sense of superiority or arrogance, where one believes they are better than others, can provoke contempt. This attitude can alienate others and lead to negative judgments. Example 1. A manager who constantly belittles their subordinates and boasts about their own achievements. Example 2. A celebrity who treats fans and staff with disdain. Example 3. An academic who dismisses others' contributions as inferior. Methods to address. Therapy, particularly cognitive behavioral therapy, can help individuals with narcissistic traits develop more humility and empathy. Creating environments that discourage superiority and promote equality can reduce contempt. Understanding these conditions can help in addressing and mitigating contempt in interpersonal and social interactions.